I'm Maureen Murdock. I'm the Director here of Health and Counselling Services, and I've had the privilege to be working here for the last 3 years. In the past 2 years, we've been working on the Carleton University Student Mental Health Framework, and I was invited to come and share it with you today. So, why did we decide to do a framework? Well, the population of students with mental health issues and in distress are increasing. There was an increased demands being placed on support services on campus and the resources to address the needs required to support this population to remain in school and be successful, and that was really important to us. Carleton University needed a coordinated campus-wide approach to responding to students with mental health issues, and we didn't have one. Faculty and staff wanted to know, they kept calling and saying, what is my role and what is my responsibility in responding to students with mental health issues? And they were asking for some guidance, they were asking for information and resources. So how did we begin with the framework? And this is an approach we took. The endeavor was initiated and supported by the Office of the Associate VP. We recognized that this issue affected all areas of the university. Now, on some campuses, it has been left to the Director of Student Counseling or Health Services to initiate interest in mental health issues, but I felt strongly that it needed to have leadership from the top, that if we were really going to make a difference, that we needed to have buy-in from everybody on campus, that mental health wasn't just an issue for us working in counseling and in health services. And from that, we created a cross-functional team to represent all stakeholder groups. So just to talk a little bit about the objectives, of the framework, we wanted to ensure there was a consistent campus-wide approach to supporting students in distress. So in the content of the framework, we articulate what the university's role and responsibilities in supporting students in distress. We make it very clear what we believe is important to us and to our students. We guide members of the Carleton community how to recognize and respond to students in distress. So that's talking about behaviors. How do we want people to respond? How do we want them to behave? So we set out and developed policies and protocols that supported an integrated approach. I mentioned 4 R's here, and I'll talk a little bit about our 4 R's later. One of the objectives of the framework was to facilitate appropriate referrals. How do we refer and when? That's what our staff and faculty want to know. If we know that there's a student in distress, what do we do? Who do we refer to? And where do they go? And how do we make those referrals? So within the framework, we have a description of the roles and responsibility of key student support services. Many staff, it's a big university, many staff and faculty on campus don't really know what each student support services are. When students are having mental health issues, it isn't always going to counseling or going to health services that is the best place for them to get the help they need. And we have a lot of services on campus. We had to raise awareness about mental health problems and how to recognize and respond effectively to students in distress. So we needed an education and training strategy. And we needed different levels depending on what your role and your responsibility on campus is. So not everybody needs the same education and training. We need to provide education and training to what our expectations were. We also felt that one of the objectives of the framework was to address ongoing needs and emerging issues. This needed to be sustainable. It's not something that's going to go away. We are always going to have students on campus with mental health issues, and we wanted something that, a framework that was a living document. So within this, we have a quality assurance and improvement process. We need to continue to look at what we're doing, to evaluate it, and then to improve it. So our committee was led by our Associate VP of Student Enrollment. Again, it was very important to have show that there was commitment, there was visibility, that this was a university-wide initiative, and also that it was going to be integrated with other mental health initiatives on campus. The committee needed to be cross-functional. We needed multi-stakeholder input. We needed a team approach. We needed to make sure we had team reference so that people knew why they were on this committee. They needed to know what their mandate was, what the reporting structure was going to be, what their responsibilities and what the activities we were going to do. So this showed we were responsive, we were going to be proactive, accountable, and sustainable. So this gives you an idea. It's a big advisory committee, but when you look at it, we have, besides myself, we have the Director of University Safety, we have the Paul Menton Center, which is for students with disabilities. We have the Director of Student Affairs, the Director of Equity Services, we had our Privacy Officer, we had some Associate Deans on our committee, and we have the Director of Risk and Insurance, we had the Assistant Director of Residence Life, we had the Manager of our Student Academic Success Center, we had the Manager of our Education Development Center, we had some communication officers on there, we had some student reps, which were really, really important and very helpful to developing this framework. And we had a counselor from Health and Counseling and some staff rep. The mandate of the committee was to oversee the development of policies, procedures, and resources in support of a university-wide coordinated approach to helping students in distress. It was also mandated to monitor these activities on an ongoing basis, to identify any evolving needs and address gaps. The framework took about a year to develop. There was a process that took place. The committee met monthly. We had a small working group to work on things that needed to get done. We did some external research. We did interviews. We did web searches to look at other frameworks, protocols, and resources that were available. We had some expert consultation in the developing of the framework. We had the University Legal Counsel come to talk to us about legal responsibilities, risk management, what the standard of care would be expected, given this is a university setting. We had the Privacy Officer talk to us about documentation and communication. We had the Director of Capacity Building and Education from the Canadian Mental Health Association talk to us about awareness and education strategy. And we had the Director of Risk Management come talk to us about risk management. We also did some surveys internally. One of the tools that we used was to do a gap analysis to see where we're at. What do we have on campus and what's available? And one of the tools we used was the JED Foundation, which is a tool from the States that looks at the developing of a framework for a student mental health framework. So this was very appropriate for us, and it was a useful tool. What was interesting to find out is there wasn't a lot of gaps, but what we were missing was a coordinated approach. So we were able to pull everything together under this framework. It also helped us to identify what our information and training needs were, and to identify any outstanding issues and resources. We went on to develop the protocols after that. We developed an education and training strategy that has a number of different levels. We also put together information folders and brochures for our staff and faculty. We had the framework approved by senior management in the fall of 2009. And then we developed its dissemination plan, which we've been doing for about a year now. The message has to get out there, but it takes a long, long time to get it out, and you have to not get frustrated and just persevere, and we're doing it in small groups at a time. We had a communication strategy and an awareness campaign. So our framework is a living document, we tell people. It's a blueprint for current and future decision-making, action, and evaluation around university-wide processes and programs. If you're interested in reading the full document, I'm going to touch base on a little bit of it here, but if you want to read the full document, you can find it on our website. We presented this in the fall of 2010 at the Student Mental Health Summit. It was the ministry-funded bringing together of student health services and student counseling services, and it was very, very well received. We're one of the few universities in the country that has a mental health framework for students. So some of the points to consider when developing the framework, or what did we have? Who is a student in distress? And that was an interesting dialogue that we had. Not everybody agrees what we're talking about. The definition that we came up with was a student in distress was not a student with stress. Distress is when the stress exceeds the student's coping skills and the need for additional support or guidance. So it doesn't require diagnosis of a mental health illness. It's responding to when it exceeds the student's coping skills. And we also had to come to some decision about what was our underlying philosophical approach to students with mental health issues. We always have to remember that the students have a right to make their own decisions, and our approach is facilitative, not authoritative. And we also have to remember that not all students with mental health issues are in distress. Many of them are stable and can manage very well in the university setting and only need our support from time to time. What was our guiding principle? So our principle was that all reasonable efforts would be made to ensure the security and safety of students, staff, and faculty. So reasonable was determined by the primary function of the university. The university exists to educate and undertake research. It would not be a reasonable expectation that the university provide the same level of care as a designated mental health organization. However, as a community who wants all our students to succeed, we did need to be aware and attentive to students with mental health issues in a caring, respectful manner. The message needed to get out that students could go to professors and staff on campus for help and would receive a positive response. And that's what the Student Mental Health Framework was getting out to people. That's what we need. So our strategy for education and training was that we found that through one of our needs assessment that many departments had gone off on their own to engage in obtaining mental health training from various sources, but there was no campus-wide consensus as what the training was needed or the approach. However, the agreement was that a systematic approach to education training was needed to support an integrated and coordinated approach to helping students in distress. So we've started over the past year. We've been going out on campus doing face-to-face presentations. Most of the presentations are done by myself with the consultant that helped us develop the framework, who's a clinical psychologist. We make ourselves available to come to any departments on campus. We do this training session, it's about 45 to 60 minutes. And we've done all the faculties, the deans, directors, and chairs. We've done a number of departments on campus. We've had presentations just for TAs, for staff, and we've done some for student peer mentors as well. To date, we've reached about 3,000 staff and faculty. But it's ongoing because our population changes every year. So we have to continue to do it and continue to make ourselves available. The presentation includes an overview of the issue, an introduction to the Student Mental Health Framework, defining of the roles and responsibility and key protocols, and we provide everybody with a folder of information so that they have a toolkit. So this is what it looks like. It's a little folder. We actually stole the idea from the University of Guelph, but they didn't mind. We did it a little differently, and the folders can sit in the staff member or the faculty member's filing cabinet, and when they have a student that they're worried about, they can pull this out, and within this, it helps guide them. It talks about the warning signs, it talks about how to make a referral, how to do follow-up, and it has some material inside here to help them. And on the back, it has a list of all the resources on campus and what they do and how to get in touch with them. So one of the important things that we talk about is the roles and responsibility and focusing on the 4 R's. And when we talk about that, one of the concerns that a lot of staff and faculty go, how will we be able to identify everybody on campus that's having a problem? Well, it's not your job to have to assess 100 students in your class, but if you know the warning signs, your job is to recognize it. And when you recognize it, you cannot ignore it. It's not acceptable to ignore. You have to respond, okay? And responding means asking the person, are you having problems? Do you need help? And then you need to be able to refer and to report, okay? And sometimes people feel a little bit uncomfortable with that, so we try to make it as easy as possible, and we've put some processes in place to help them. The protocol to respond to student distress also covers how to respond to a student who's in, how to differentiate between someone who's urgent and non-urgent, because it's very different. How you're going to respond to a student who's in urgent need versus non-urgent. What the role of safety on campus, because we needed to broaden that. They're here 24/7. We needed to have people to understand and feel comfortable using their services. We needed to have a way for people to submit an online incident report if they're really, really concerned about a student and feel that there needs to be an intervention. And we had to talk a little bit about follow-up. How do we follow up? Why is it important to follow up? If you've suggested to a student that they're having problems and they need some help, there needs to be a follow-up component to close the loop. And also, one of the issues that we talked about a lot is, what do we do if the student won't go for help? That is so stressful for everybody on campus if the student declines. So we talk a little bit about that in our presentations. What do you do? How do you address that issue? And we also cover communication and documentation. We have a little bit of a quick referral guide. It's found in their package so that they can take that out and go through it easily. Some questions to ask to help them determine if it's urgent versus non-urgent, where to go, where to send people. So that gives them a quick guideline to follow. And within the framework, it's emphasized the importance of using discretion and confidentiality when communicating and responding to a student in distress, and we talk about that as well. So some of our lessons learned, well, one of them was that leadership and endorsement at the highest level signals that this is important. All members of the university community have a role to play. Helping students in distress is not solely the responsibility of specified student services on campus. We also, one of the lessons we learned is multi-stakeholder representation is essential for the framework to address real issues. Students play a very important role, and they have a lot to say about privacy and confidentiality. So, because I was coming here and presenting to you, I thought I should say something about reducing stigma. This wasn't something that we measured or looked at. We were looking how to improve services to students with mental health issues. But I think when you look at the student mental health framework and some of the things that we talked about yesterday about changing behavior, you change behavior by changing expectations, and the student mental health framework is clear about expectations from staff, faculty, and students. And that everybody is expected to participate, that mental health is an issue for all of us on campus, that there are documented guidelines to follow so there's less ambiguity, knowing the right thing to do. Sometimes people are afraid to get involved They fear that they're not sure they're doing the right thing. So by having a student mental health framework, by having some protocol and processes, you're helping people to feel more comfortable with the issue. The staff and faculty receive face-to-face education. I think that's so important. They can ask questions, share their concerns, and you can deal with them. Because some of them need that opportunity to sort of sort through, you know, how do I address this issue? How have I addressed it in the past? And what am I going to do going forward now I have this new information? They get resources are outlined and contact information are given to them within the framework. And I think having the framework means that mental health of our students is important, and it also signals it's a priority for Carleton University community. That's it.